Alrighty, folks, we're on a roll today. We're getting through a number of these medical exercise training 101 ebook video sessions in our series. We're going to talk about number 18. Now, this is one I get commonly. What are the most common conditions I will see in my MET practice? Now, most common conditions, we got a list here. If you look at the show notes, we actually have a nice graphic there of what we call the Big Six. But let me read this for you. Medical exercise training services are growing, and everyday medical exercise specialists are seeing clients with a wide range of conditions. You may see some of the more exotic conditions, including cancer and closed head injuries and amputation and organ transplants. This is, again, all after they finish with physical therapy and occupational therapy and the doctors refer them. But most common conditions you're going to see in an MET practice include total joint replacements, hips or knees or even shoulders, and we've seen other joints replaced, diabetes, osteoarthritis, hypertension, low back pain, and obesity. If you look at the show notes, you'll see a nice graphic there. This is only a small portion of the conditions you will see in your practice, but these are the most common ones. Since 1994, when we started postrehab.com, the list of conditions that our medical exercise specialists have managed has grown exponentially. If you've seen a condition that you feel is unusual in your practice, we'd love to hear about it. Email me at drmike@postrehab.com. But if you would, please make sure you download a copy of this ebook, but please join the MedX Pro Network and tell us about this wide range of conditions you're seeing. And I know in many instances, you're a lone ranger. You're the only one in your community seeing these types of conditions, and you're lost. You're in over your head, or you may be doing a fantastic job. Either way, we want you to share that with other like-minded and similarly trained medical exercise professionals, so now we can establish best practices and standards for our new profession, medical exercise training. This is going to grow, folks. And the great thing about physical therapy or occupational therapy or any aspects of medicine, you always have a group of colleagues to communicate with and a database of information to access. Folks, I can tell you from teaching this course and developing resources and guidelines and protocols, there are not a lot of resources and guidelines out there for you because everything is geared toward the physician, the therapist, or the chiropractor, and you're kind of piecing things together. So you might want to join our network just to have another place or a better place to dialogue with colleagues, come up with solutions, ideas, and strategize. So thank you for listening to this one. If you would, please come back and join us for session number 19. We'll talk about the average number of MET sessions clients will require based on their diagnosis. Thanks again. Take care.